Hi, my name is Sonia Williams, and today we will be discussing concussions. In my group, we have Claudia, Peyton, and myself. So the first thing that we have to talk about when we talk about concussions is the anatomy involved in a concussion. So the first thing I have is kind of a definition that I got from the CDC. So the CDC defines a concussion as a mild traumatic brain injury. It's a complex pathophysiological process affecting the brain. It's induced by a traumatic biochemical force. Secondary would be direct or an indirect force. And then concussions are more a neurometabolic dysfunction rather than a structural injury. So obviously if somebody broke their leg or their arm, that's something that a physician or a doctor would easily be able to see and say, oh, you broke your arm. Whereas concussions are a little bit harder, especially because I know sometimes players can lie. They can say, oh, my head feels fine, I don't feel dizzy or anything like that. So it is something that you have to be able to analyze basically by a questionnaire. You're not going to be able to just look through somebody's brain and say, oh, you have a concussion. So some of the symptoms that go along with a concussion is a physical, cognitive, emotional, or sleep-related symptoms. A lot of high school athletes report having headaches, confusion, dizziness, and visual disturbances. I know sometimes when people get concussions, bright lights can kind of make it worse. A lot of times we try to tell people to stay home and rest just because they really shouldn't be up moving around. Because they did injure their brain, which is basically one of the main central parts of our body. And then secondly, those symptoms are not set. So somebody can have symptoms for as long as several minutes. Some people can have them for several days, weeks, or months. It really just depends on the severity of somebody's concussion. Some of these concussions can be caused by football. Some people get hit really hard in the back of the head. I know a couple times when I was playing basketball, I took a charge and sometimes my head would flop back and I would hit the back of my head and get a concussion. Severe car crashes can have a concussion. Boxers, obviously, when they're punching people in the face, it's very easy to have a concussion. And the reason how you get a concussion is from a brain twist or a really hard hit against the skull. So sometimes, obviously, when you're in a car crash, your body's moving all around. Your brain really isn't secured in there, so it's very easy for anything hard for it to start rattling around in there, and it's basically going to cause pressure from pushing up against your skull. Other than that, I will pass it on to Claudia, who will do her slides.
Hello, my name is Claudia. I'm going to start by talking about the mechanism of concussion. What does that mean? Mechanical concussion is basically like the what caused the concussion, or like the force or force supply to the head or neck that caused the concussion. So the mechanisms of concussion are divided into direct or indirect contacts. When we think about direct contacts, we really think about contact sports, right? So like some examples of that are American football, soccer, and basketball. Another type of direct contact is when we get hit by something, or like when something hit us, right? And then another example is like when we fall and we hit with our head in the ground, or like we hit our head in some object, like a hard object, and that can also cause the concussion. Moving now for like, we have indirect contact, which is characterized by like the rapid or sudden like acceleration and deceleration of our head or neck. And that normally happens like in a car accident or like a car crash, when there's like this movement of your head and like your brain like shifts really quickly, causing a brain injury. And another example is during the amusement park rides, when there is also like that characteristic like rapid movement of your head. Moving forward to the recognition and evaluation of concussion, we're gonna like see like some symptoms of concussion, like headaches, like blurry vision, or like any kind of this list that is here, like nausea, and can also like cause some loss of consciousness or not, like it depends of the concussion. Following to that, we have evaluation of the symptoms. So we're gonna ask like basic questions to the person who got concussed. Like we're gonna ask like, what's your name, like what type of play you just did, or like any of the simple questions to see like the mental state of the person. Then we're gonna move to the observation part. So like we're gonna see if there is like a loss of caution or not, and like we're gonna fall into to determine what grade of concussion there is, grade 1, 2, or 3. Then we're gonna move forward to like the palpitation. So like gonna check for any point of pain on the neck and head, and see like what kind of cause, or like what kind of procedure to perform afterwards. Based on that, we're gonna like always check further testings, and like the concussion testing, which are like the neurological and motor skills, which are gonna test your reflexes, your balance, and like your head, your hearing, and basically the mental status. Moving forward, like we're gonna like also test your cognitivity. So like you're gonna gonna check like your mental, your thinking abilities, and like what kind of abilities got affected by. And in order to like, and later like everyone's gonna like want to have like a skin test, which is basically like a CT or MRI, which are gonna like allow you to see like any like internal injuries.
So for treatment and surgical correction of a concussion, surgical correction or surgery is just typically not going to be required. There's obviously extreme cases where surgery could be required, but for the vast majority of concussions, you're not going to require surgery. Ultimately, treatment just boils down to physical and mental rest, just giving your body time to heal and not putting too much physical or mental stress on itself. You're going to want to avoid specifics which trigger the symptoms that you're experiencing. So anything like looking at screens for too long, listening to music too loud, loud noises, physical activity, etc., any of that kind of thing. These activities are going to put more stress and kind of make your symptoms worse. So you're going to want to avoid those while you're healing up. Pain is obviously going to be a pretty common symptom for concussion, and the way that you're going to deal with this is just over-the-counter medicines, specifically those that are used to help with headaches or nausea, because these are very common symptoms for concussion pain. Like I said before, you're very rarely going to need to have any surgery done for a concussion. For rehabilitation and return to play, it's going to be broken down into 3 phases for a concussion. The first phase is the acute symptomatic phase. So this is going to follow right after the injury occurs, up to about 3 days after. It could be a bit longer. But in this phase, you're going to be experiencing symptoms such as loss of consciousness, pain, confusion, amnesia, which is loss of memory, etc. Obviously, you might not experience all of these symptoms. Most likely, for most cases, you're not going to have all of these. You might just have 1 or 2. It really just kind of depends from case to case. After this, you're going to go into the recovery phase, which is phase 2. This is going to partake in the gradual return to activities, lessen symptoms whenever you're partaking in the activities that were stressing out your symptoms, as I mentioned before. So you can start to do things such as, going to the gym or going on a walk without experiencing any more pain compared to what you were before. It's not going to make your symptoms worse. And the third phase and the final is going to be the recovered phase. This is when the individual has recovered completely and is back to their pre-injury state. You can do all of these activities with no worsened symptoms and pretty much just back to how you were before the injury occurred.